Hi, my name is Emily. I'm with Employee Health and Infection Control here at ANTHC. Today, I'm going to be explaining how to safely don and doff your personal protective equipment, also known as PPE. There are four main categories of transmission-based precautions used routinely at ANMC: contact, modified contact, droplet, and airborne isolation. Each category prescribes the minimum piece of PPE that must be worn to keep healthcare workers safe from the target pathogen. At times, two or more categories of transmission-based precautions are implemented to protect healthcare workers. Periodically, CDC recommends that healthcare workers wear additional PPE along with PPE prescribed in the main transmission-based precaution categories. Generally, these recommendations are in response to an emerging pathogen where the route of the transmission is not well studied. Today, we are going to discuss donning and doffing PPE when entering a room with contact and airborne transmission-based precautions, plus recommendation to wear eye protection. Before you enter the patient's room, you will need to don your PPE. You will want to make sure that you're donning your PPE in the correct order so that when you take it off, you don't accidentally contaminate yourself. First, please pull back your hair and control any stray hairs. Facial hair should be shaven before donning an N95 respirator. Wearing jewelry is discouraged as it can compromise your PPE, and check your PPE for any defects such as tears in the isolation gown and cracks in the face shield. Then perform hand hygiene before you don your PPE. Next, you want to protect your body. You will don your yellow isolation gown with the opening towards the back. The sleeves of the yellow isolation gown have thumb holes to assist in keeping the sleeves down and protecting your wrists. Then tie the gown around your waist, closing the back to ensure that the back of your torso is covered by the isolation gown. Next, you will don your N95 mask. Remember, never use an N95 mask you have not been fitted for. Always use the mask you were fitted for at Employee Health with your annual fit test. When donning your N95 mask, the bottom strap should sit at the base of the skull and your hair should be pulled out from between the strap and your neck. The top strap will sit at the crown of your skull. Then using two hands to pinch the flexible band to your nose bridge. Then don your face shield. Your face shield will be placed over your face and eyes and adjusted to fit. And last, your gloves. Making sure that your gloves go over your sleeves of the yellow isolation gown and your wrists are fully covered. Now you may enter your patient's room. Remember to keep your hands away from your face, limit surfaces touched, and change your gloves when torn or heavily contaminated, and always perform hand hygiene when changing your gloves. For doffing your PPE, you will remain in the patient's room, standing at the doorway and at least 6 feet away from the patient. You will doff your PPE, except the respirator, until you've exited the room and performed hand hygiene. You will perform hand hygiene a minimum of 4 times during the PPE removal process. First, break the waist ties by pulling at your waist and away from your body. Next, cross your arms and place your hands on your chest below your shoulders. Break the neck ties or back seam of the isolation gown by pulling forcefully away from your body. By keeping your hands in the sleeves of the gown, roll the gown from the inside out and away from your body. Once the gown is rolled up, remove your hands from your gloves and the sleeves and then dispose in the trash. Perform hand hygiene. Next, remove the face shield by using the face shield's headband and pulling it forward and over and away from your face. Perform hand hygiene. Remove yourself from the patient's room and make sure the door closes fully. Perform hand hygiene. Lastly, you may remove your N95 respirator. Remember, do not touch the front of the mask to remove it. Instead, grabbing the straps of the N95 respirator, lean slightly forward and carefully remove the bottom strap first, allowing the strap to fall in front of the mask. Next, remove the top strap and then remove the mask away from your face. place the mask in the trash, and then perform hand hygiene. Next, I will demonstrate how to don and doff PPE while using a powered air purifying respirator, also known as a PAPR. Remember to only use the PAPR if you've been trained to do so. First, perform hand hygiene. Next, you will don your PAPR prior to your gown. The belt of the PAPR will go around your waist. Then don your gown to ensure that the belt is fully covered by the front of the isolation gown. Then tie the gown around your waist, closing the back to ensure you protect the back of your torso, leaving a small opening for the PAPR itself to stick out from the gown. For doffing, first, break the waist ties by pulling at your waist and away from your body. Next, cross your arms and place your hands on your chest below your shoulders. Break the neck ties or the back seam of the isolation gown by pulling forcefully away from your body. By keeping your hands in the sleeves of the gown, roll the gown from the inside out and away from your body. Once the gown is rolled up, remove your hands from your gloves and sleeves and then dispose in the trash. Perform hand hygiene. Remove yourself from the patient's room and make sure the door closes fully. Perform hand hygiene and don a clean pair of gloves. Then loosen the chin tie and lift the hood up and away from your face to remove. Turn off the PAPR and thoroughly disinfect your hood and all pieces of the PAPR unit following cleaning protocol. Remove your gloves and perform hand hygiene. It's important to ensure that the PAPR intake does not become occluded by the gown, thereby blocking the airflow. If this occurs, the PAPR will begin to alarm with a steady beep. For those of you who are tall or have a longer torso, make sure that the hood is not kinking at the top. Your belt of your PAPR may need to sit higher on your waist or torso to prevent this from happening. For any further questions, please refer to Employee Health or Infection Control at 2900. You may also reference the CDC website on donning and doffing personal protective equipment. Thank you for watching this video on donning and doffing personal protective equipment.